Welcome to the video series for the Commission's Foundational Report on Racism in Nursing. My name is Dr. Mary Joy Garcia-Dia. We welcome your exploration of this topic with the hope that it will bring light a serious problem within the nursing profession that impacts our colleagues and the patients and communities for which we care. This section on policy is a revelation for me. Growing up in a country where dictatorship has been the norm, I can relate on how we look at policy as the law of the land and not question it. In nursing, we go back to the policy manual where there are questions on practice and human resource issues. The way policy is designed can influence knowingly or unknowingly one's career and professional trajectory. Policies intended to be applied regardless of race are placed into the hands of leaders, managers, employers, and others whose own biases can impact the creation, application, implementation, and evaluation of the policies. Our conversations and the barriers identified during the listening sessions convened in 2021 by the National Commission to Address Racism in Nursing described how racist thoughts transcend into acts of discrimination and oppression that results in disparities in advancement, lack of inclusion in decision-making process, and inequities in compensation. When these policies are created as part of the organizational structure and governance, are the voices of nurses of color represented? What are the statements in the policy that can exclude internationally educated nurses to navigate the systems of policy as they move up the career ladder? Are there criteria and processes for admissions or applications for promotion to advance oneself professionally, designed consciously or unconsciously to put barriers and becomes a hindrance? Do we have sufficient representation and consciously avoid tokenism and the expectation that one individual can represent the entirety of a profession or race and ethnicity? These are relevant questions as these impact one's professional and personal journey. An equitable policy can make a difference on the socio-economic development of the individual and potential contributions that individual can make in uplifting his or her own community. Please read this section with an open mind and evaluate your existing policies in your institution. The overall goal is to have tools in place that promote equity and social justice in our policy-making process.